COVID-19 briefings. This is a briefing on the current response in the country from the National Emergency Response Committee as at November 24th, 2020. Today, I would like us to reflect on the situation of the coronavirus pandemic in the last couple of weeks. It is now clear that our numbers have been rising at an alarming rate. And just to jog your memory, with the rising cases, our positivity rate has been fluctuating between 14% and 20% in the last 1 month. And as you may all be aware, according to the World Health Organization, for a country to be declared free of the virus and for normal business to resume, you must have, amongst other measures, a positivity rate of 5% or below for a continuous 14 days. And so when we reflect on our current positivity rate for the past 1 month, we can see that we are far from attaining this target. And additionally, we're even making it more impossible for us to be able to resume our normal lives. We must therefore, fellow Kenyans, strictly adhere to the containment measures that the Ministry of Health has issued since the pandemic struck in March this year, if we are to bring this positivity rate down. And there's no two ways about it. We shall not tire to repeat the message in terms of the containment measures, that we need to wash our hands with soap and water. We need to wear our face masks at all times in public places. We need to maintain social and physical distance. And more importantly, we need to avoid all public gatherings, be they social or political. Fellow Kenyans, the government and the Ministry of Health in particular attaches great importance to the work that is being undertaken by all our healthcare workers countrywide. Healthcare workers are our frontline soldiers in this war against the pandemic, and contrary to the reports circulating in sections of the media and elsewhere, we have not neglected them. Neglecting our soldiers would be tantamount to facing an enemy without any defense. And the needs of our soldiers therefore must be met in order for them to render their services to protect us all. And so the government, through collaboration, national and county governments, are working around the clock to ensure the needs of our healthcare workers are taken care of, not only to enable them to face COVID-19 with confidence, but also to deal with all other diseases that are afflicting our people without fear or apprehension. And these measures, these interventions that we are putting in place to protect them include amongst them the provision of comprehensive insurance cover for civil servants and the National Youth Service. Last week, the government, through the Ministry of National Treasury and Planning, launched the first ever comprehensive insurance cover for civil servants and the National Youth Service. The enhanced insurance cover includes work injury benefits and group accident cover. Accordingly, after elaborate consultative meetings with all key stakeholders, including the Ministry of Public Service, amongst others, it was agreed that in addition to enhancing the existing group personal accident cover and work injury benefits act cover, the provisions should be extended to include a comprehensive group life cover to cater for all causes of death, including death arising from critical illnesses such as COVID-19. These provisions have been extended to all civil servants. This includes our healthcare workers and also touches on all other civil servants and employees of the National Youth Service. Through a cabinet meeting on 10th of September 2020, there was approval of this proposal and a mandating of the National Treasury, the State Department of Public Service, and the National Hospital Insurance Fund to roll out the scheme, noting the urgency of full implementation. You may also recall that at the onset of the pandemic, the National Treasury and Planning, alongside key stakeholders, was tasked by His Excellency the President to look into ways in which we can cushion our healthcare workers who are our frontline soldiers, by taking care of their health and insurance requirements, especially during these challenging times of COVID-19. And so, under this new scheme, the civil servants and the employees of NYS will for the first time have this comprehensive cover with a total annual premium of about 6 billion shillings per year. And as we reflect on these developments, it is also useful to note that health is a devolved function and that county governments are mandated to take care of the welfare of their employees in this sector. We are in collaboration and consultation with the Council of Governors, which is currently deliberating on how to handle these areas that are covered under the devolved units. In this regard, discussions are underway at COG as well as with the National Treasury to ensure that outstanding issues are appropriately addressed, and this is expedited. There are also various consultations that are going on between officials of all healthcare worker unions and the NHIF to ensure a firming up of the same. Once these consultations are concluded, we shall be informing public of the outcomes and the way forward when it comes to cover at the county level. With regard to the personal protective equipment, and following our meeting with the Council of Governors in Mombasa a fortnight ago, the Cabinet Secretary in the Ministry of Health directed that KEMSA supplies PPEs to all counties at the prevailing market rates, and that position has not changed. County governments are free and have been requested and urged to draw down their supplies to secure PPEs for their healthcare workers at the prevailing market rates. Now, turning on to our COVID-19 situation in the country today, we have 727 people who've tested positive for the virus from a sample size of 4,913 tested within the last 24 hours. This therefore brings our total count in the country to 78,512. From these cases, 705 are Kenyans, while 22 are foreigners. 458 are males, whereas 269 are females. The youngest is a 4-month-old infant, while the oldest is 88 years old. And in terms of distribution by county, Nairobi leads with 306 cases, Kiambu 122, Kitui with 38, Uasin Gishu with 33, Kajiado 27, Machakos 25, Murang'a 22, Busia 21, Mombasa 19, Garissa 17, Turkana 17, Kisumu 14, Kilifi 13, Nyeri 8, Nakuru 7, Kirinyaga and Kwale both have 6 cases, Baringo 5, Embu, West Pokot, Siaya have 4 cases, whereas Isiolo and Kisii have 3 cases, Makueni has 2, and Mandera has 1 case. We have provided you with the sub-county disaggregation, highlighting in each county which county has the highest number of cases, all the way to the least number of cases. On a positive note, 806 patients have recovered from the disease, 701 from the home-based care program, while 105 have been discharged from various hospitals. And so total recoveries stand at 52,709. And we continue to thank our healthcare workers for their continued dedication to duty that has enabled us to achieve these results. And sadly, we have lost another 17 patients to this disease, bringing the fatality to 1,409. Our sincere condolences to families and friends of those who have lost their loved ones. With regards to the 1,196 patients admitted across the facilities across the country, while we have 7,139 that are on home-based care isolation, we have 51 patients in the ICU facilities, of which 29 of them are on ventilatory support, whereas 18 of them are on supplementary oxygen. And we have another 106 patients separately who transitioned out of supplementary oxygen. 94 of them are in the general wards, 12 of them are in the high dependency units. We thank you and we welcome questions.
Anita Nkonge from NTV. Yesterday, Oxford and AstraZeneca announced that clinical trials when it comes to the vaccine has a 70%, what's the word? 70% effect on efficacy. Thank you very much. And we understand that there are Kenyans who have also been in that trial, and that we're wondering what is the MOH's position in regards to this clinical trial. Are we in discussions to buy it or not, or what's happening?
My name is Abdiaziz Hashim from Ibru TV. I just have one question for you, CAS. You've just said that the positivity rate in the country keeps on fluctuating. Now, is the government, the whole government, national plus the county government, ready to combat with the second wave in the country?
Zainab Mohammed, TV47. We had a presser with KNPDU earlier today, and according to them, doctors who are in referral hospitals and in universities are not covered in the medical cover that you've just announced. And they're saying if these doctors are not covered, then they're going on with a strike on 7th of December. What do you have to say about that?
Thank you. Thank you for your questions. Anita from NTV has touched on the issue of the AstraZeneca vaccine. Anita, your question comes in at a very timely moment because we have just finished a debriefing meeting with the CS on this vaccine, and the teams that are running the vaccine in Kenya, this is a KEMRI Kilifi Wellcome Trust team, are actually ongoing in terms of the trial and have given us a good update. To start with, we have about 400 Kenyans who have been registered in this trial. The trial is currently underway. The results that we saw in the media in the last 1 week from Brazil are parts of the larger trial that is currently being conducted in Kenya. We hope that by the end of the AstraZeneca trial, we will have reached about 60,000 participants. In terms of progress, Kenya is at the process of collecting data. So as we speak right now, data collection processes are underway and they are progressing well. Now, when it comes to the question you were asking on vaccine efficacy, the effectiveness of the vaccine, I think in the last 2 weeks, we've seen reports from different vaccines, from different companies reporting different measures of efficacy. When we say a vaccine is, for example, 70% efficacious, it means that is the potential of the vaccine to reduce the risk of transmission for COVID-19. The current vaccine trial in Kenya is going on well. We do not have that number yet here in Kenya. So the number you've seen in the media is a number from Brazil, the trial that is happening in Brazil. And sometimes you can have differences in terms of geographies when you're testing a vaccine. What we are doing currently as a ministry, through the NERC, we have formed what is known as a COVID-19 vaccine task force. So there'll be a new structure formed, which will then, go ahead to develop a policy and guidelines and plans of how this vaccine will be rolled out once it is available. And before it is rolled out, there are 3 key measures that we will be looking at. 1, to ensure it is safe for use. 2, to ensure that it actually does what it should do. And 3, to ensure that it is actually efficacious, it is effective. And so these are processes that are currently underway. We're quite excited. We are going to have discussions with AstraZeneca here to see how we can ensure that Kenya is first in line, because only about 8 countries are participating in this trial, and Kenya is the second in Africa after South Africa. So there are discussions to see how will Kenya benefit from taking part in such a trial. So all these are discussions that are underway, although we are excited. Our teams, our KEMRI Kilifi teams are on this trial and are, reporting possible good success of this vaccine. In terms of Abdi's question from Citizen, is the government ready? Yes, we are ready. Despite the increasing number of cases, we are continuing to collaborate with county governments. We've recently concluded an assessment on the preparedness levels at county levels. I think this has been shared with you previously in the media. And every time we're reflecting on readiness, we're looking at, do we have enough beds? Do we have enough oxygen? our healthcare workers trained? Are they ready, to be able to combat this disease? All these measures in terms of a skill, we are okay and we are safe and we should be able to combat this. We have, through different meetings with Council of Governors, identified some key challenge areas, such as the delivery of oxygen, and county governments have committed to be able to ensure they secure resources to avail oxygen where it is needed. In terms of the question from Zainab, TV47, concerning doctors who work in universities, like I've mentioned, this is an issue that is being discussed. There are different workers who, are in different groups in terms of mandate. What we can say today is that we are happy, all civil servants are covered, but we are aware that more work needs to be done to ensure that workers working in county governments are covered, as well as aligned institutions, such as universities. And so these discussions are underway together with National Treasury to ensure at the end of the day, all our workers are covered.
One final question. Raquel Muigai, Citizen TV. The return to sports protocol did not include football, and the Football Kenya Federation has announced that they'll have the league starting on Saturday. Has the ministry given the go-ahead for this?
Thank you. Thank you, Mugai, for that question. Again, through the NERC, the ministry is engaging with teams from the Ministry of Sports to relook at those protocols, to try and find mechanisms in how that can continue forward. And so I'm glad to know that CS Amina is on this with the team together in the Ministry of Health, and they'll be releasing the way forward when it comes to that.
And that was Health CAS, Mercy Mwangangi, detailing exactly what the state of COVID-19 in the country is. She said the numbers are rising at an alarming rate, and also moved to assure healthcare workers that the government has not neglected them. In recent weeks, we've seen healthcare workers come out to speak about their ordeals on the front line, most of them actually saying that they feel they have been neglected. The Health CAS speaking to members of the Fourth Estate and saying that the government is working around the clock to ensure that healthcare workers' interests are looked into. We also have learned that there are 727 new positive cases in the last 24 hours. 727 people have tested positive for COVID-19, bringing the total tally to 70,705. 17 deaths in the last 24 hours, bringing the total fatalities to 1,409. Nairobi County continues to lead with the highest number of infections of COVID-19. We're back at the top of the hour with more news. Stay with Citizen TV.